Welcome to Let's Get Curious, the podcast for women and mothers seeking connection, support, and inspiration. We are friends, mothers, and therapists. Lori, a physical therapist, and Dorothy, a speech and language therapist. Together, we share our personal stories, including IVF, birth experiences, and navigating children's learning difficulties. Through our discussions, we uncover profound lessons for personal growth. Join us on this journey of curiosity, compassion, and empowerment. Welcome to Let's Get Curious. Well, welcome, trainer Natalie. How are you today?
I am well. Thank you so much for having me.
I'm excited to have you on, as I've been, plugging along there on Instagram and letting everybody know of all the information that you're going to be sharing with us today. I value your experience, just all the years that you've been doing this as a doula, exercise specialist, so I know you're going to bring us some really good and fun tips all about the pelvic floor. So with that, I would love for you to just tell us a little bit more about yourself and how you got into this line of work.
Yeah. Okay. Loaded question. Right off the bat. I love it. So I started out, I would say, let's start in 2014. That's when I basically started this work. I became a doula during that time. I was also learning to teach Pilates at that time. And during my work as a doula, during my Pilates teaching stint, I learned about issues that stem from childbirth and pregnancy, like incontinence and prolapse. I was able to attend and kind of assist a post-baby class at the Pilates studio I was working at. Taught by a PT, a pelvic PT. And I learned about all of these things, diastasis, and that exercise could be preventative and also restorative for these issues that happen. And so the wheels started turning and I started doing a little bit more research. I was in line to go to nursing school at the time. And I quit nursing school. I was like, this is not what I want to do. I don't want to work with people who are sick. I want to work with people who want to get better, who are healthy, who need to move their bodies and know how to move their bodies and want that for themselves. And so then I launched into a degree in exercise science and have knitted together my doula work, Pilates experience, exercise science background, and clinical exercise physiology as well. My experience in a more medicalized clinic, wellness center. And that's kind of brought me to where I am today.
Here you are with the love of the pelvis. Yes?
Absolutely. Absolutely. Yes. I've acquired a couple pelvis models along the way.
I see this all the time, seeing patients as a pelvic floor PT. And after even women have given birth, I'll be like, do you know what the pelvic floor muscles even look like? And they're like, I have no clue. So we need to educate and show, people what this area of our body looks like, because I think a lot of times, unless you have, even if you do have a problem down there, you don't really understand the anatomy and all of its functions. Absolutely. So with that, then, why don't you take us into kind of just explaining the general pelvic floor anatomy and function and kind of give us an overview of that.
Okay. Yeah, that's a great place to start.
Thanks.
Okay. I'll use my words as well. So
yes.
Here's the pelvis. And if you are not watching, you can put your hands on your hips and feel your pelvis, your hip bones there. So you have two sides of your pelvis. You have your two hip bones. In the back, you have your sacrum and your tailbone at the bottom. Now your sacrum is mobile. It kind of tucks under, like think a dog tucking his tail between his legs, or coming back out, like a little bit of a booty pop or arching your low back, that direction. You also have in the front a pubic joint. A lot of times we refer to this as a pubic bone, but it is actually a joint. And if you have been pregnant and have pain with that joint, you are well familiar with where it is in your body. So that kind of is the top view of the pelvis. If you're looking from the bottom, like if you're looking from the feet up, or you're sitting down while listening to this, you can kind of rock back and forth, side to side, and feel your sit bones underneath you. So that's another landmark that you can use to identify your pelvic floor. So the pelvic floor is a network of muscles. There's nerves down there. There's blood flow down there. There's ligaments. There's so many things packed in this like tiny little package, but it's really foundational, and it's the bottom of the core. So if you are sitting, then you can feel those sit bones underneath you. You've got the pubic joint in front and tailbone in the back. Everything in that space, kind of what you're sitting on, is considered your pelvic floor. If you're standing, you can kind of think about, am I tucking? Am I untucking? How is my pelvis sitting in space right now? And imagine that the space right over your ankle bones underneath your core is your pelvic floor. So something to think about there is it really is the base of our core. And we can't talk about our core or core strength or core retraining without our pelvic floor. We're missing a crucial piece. And I think that's part of the reason why we have so many issues and we've never been taught about our pelvic floor, because we skim right over it,
Yes,
even though it's pretty much the center of the universe, as you know, in my world. And so we have to talk about it. I think it's becoming less taboo, thankfully, right now, but still I encounter people all the time who have no idea what the pelvic floor is. So that's kind of the basis there. The muscles of the pelvic floor, they function much like a trampoline. So if you think of them kind of sitting at the bottom of your pelvis, holding up your pelvic organs, holding up everything inside, ideally, they can ebb and flow. They don't just hold still all day long. They lengthen and expand and kind of, bulge isn't the right word, but they drop down. They lengthen that way. So not any pressure. We're not feeling pressure or bearing down, but they expand and open. And then they also do the reverse. They lift up and in and contract. So that's kind of the main movement of the pelvic floor, which should be in coordination with your breath. So if we're talking about the entire core system as a whole, and I know I'm like getting beyond the pelvic floor here, but you can think about your diaphragm at the top of your core. And if you have your hands kind of around your bra band line and you breathe in, ideally you can get some expansion in that rib cage. That's your diaphragm moving down and out. And in doing so, once it moves down and out, it increases the pressure inside your abdominal cavity. So it's called intra-abdominal pressure for the nerds in the crowd. As you breathe in and that diaphragm moves down, there's a necessity for the pelvic floor to expand and absorb that pressure placed upon it. And so it releases, or should, as you inhale. And then as you breathe out and your ribs kind of come back together, your diaphragm relaxes and goes back upward, then there's more wiggle room inside and the pelvic floor can lift. So an ideal breath cycle is when you inhale, your diaphragm comes down, your pelvic floor releases and lengthens. You exhale, your diaphragm goes back up and your pelvic floor contracts and lifts as well. So that's kind of something to visualize and think about as we're talking about all of the topics we're going to discuss today and breathing. So
yes.
Yeah.
Well, I think that's a great overview. And that's the piece where you guide somebody in taking a breath. And a lot of times you just see them lift through the chest. We have so many inverted breathing patterns. So a lot of times, at least in my experience, when I'm trying to retrain a postpartum client, we have to go back to just the basics of breathing. And a lot of this stuff could be boring work. But just as Natalie said, if you don't have that foundation, you can't build and reverse the problems that you may be having during pregnancy or postpartum. So what are some good habits, Nat, that individuals can be doing with their pelvic floor even just now? And even if they're not planning to have babies, because as you said, this is the foundation, this is our core. And so many times we're taught that the six-pack abs are what makes up your core. And no.
There's so much more to it. There's so much
more to it. And this is why we have to get that education out there of the importance of the pelvic floor being essentially the core. And so, yeah, what are some good habits that we can start practicing today?
Okay, there's so many. I'll start listing them. I can't even give you a number because there might be like 10 plus, but we'll start simple. The first thing that I would say is pay attention to your posture. Pay attention to how you're standing and how you're sitting. If you are chronically standing with your pelvis tucked under, like that tailbone tucked between your legs, and you're pushing your hips forward, I talk about this all the time. That alone can increase your chances of leakage, whether you cough, sneeze, jump, run, and you find yourself leaking, whether you've had a baby or not. And it also can increase the tension in the back of the pelvic floor. So remember, I said that sacrum moves. It tucks in and it opens back up. If we hold it consistently tucked, then the muscles in the back of the pelvic floor will be tight in excess and pull the tension kind of away from the front of the pelvic floor. So it doesn't have that resiliency or ability to catch a cough or a sneeze or a jump right in time. And so we have an unbalanced pelvic floor. And oftentimes, this may surprise some of you, but oftentimes leaking is more so due to a too tight of a pelvic floor or an unbalanced pelvic floor than it is a too loose of a pelvic floor. And so just doing a bunch of Kegels, if you are already in a non-optimal position of length with those muscles, is not going to solve the problem. It might actually make it worse. So bringing that all back to posture, if you untuck your booty, so bring your hips back, release your glutes. You don't need your glutes just to stand. Everything should be a glute-free exercise when you're just standing or sitting. So if you're sitting, then pay attention to whether you're slouching back into the couch. And this isn't to say like don't ever do that, but be mindful. If you are doing that more of the time than not, then your body is really smart, right? It follows the path of least resistance. It's not going to take more energy to release those muscles if you're not asking it to. And so oftentimes we end up with that tightness just because of how we're sitting all day long. So untuck those booties. You can even sit on the floor. That's one of my absolute favorite things to encourage clients to do. Sit on the floor because it can get uncomfortable and then it requires you to move. So the more shapes and geometry, so to speak, that you can expose your pelvis to sitting in different positions on the floor, the more balanced those muscles are going to be. And that's just movement. It's not even adding any exercise yet. So that's a really good positional thing to try. Add a cushion underneath your hips. Right now, I sit on the floor to record podcasts. So I'm sitting here on a cushion, and that allows you to stay in kind of a more untucked, neutral position without feeling like you're straining. Speaking of straining, use a squatty potty when you poop or find a stool. Yes.
I have them all throughout the house here.
They are incredible. And I don't even go anywhere without one. I got the travel one. It fits right in my suitcase. It's incredible. Have you ever been in a hotel bathroom where there's not even there's a flimsy garbage can, you try to put it on its side for a squatty potty and it just fails. So invest in a travel squatty potty if you travel. But by raising your feet up, not by lifting your heels, because that actually might tighten your pelvic floor, believe it or not, if you're just lifting your heels off the floor when you're pooping. Bringing the level of your entire foot up brings the knees above the hips and releases your pelvic floor so that you can have a straight shot. It opens the chute so you can have a more efficient poop. Chronic constipation, which we can talk about kind of some more of the causes and things about that, but it can cause you to strain and bear down and put unnecessary pressure on that pelvic floor. And it can lead to a lot of other pelvic floor dysfunction over time. So if you are constipated, number one, I would address your diet and your water intake and your electrolytes and all of that, but do yourself a favor and raise those feet up when you are going to the bathroom.
I know. I have a saying, cover, don't hover. All my friends, of course, every time I now go to a public bathroom, I think of you. Because hovering, when we sit down to go pee, our pelvic floor has to relax so that the bladder can contract and push the pee out. So when we're hovering in the squat position, then the pelvic floor is also contracting to hold you into that squat. And then you're having to use more pressure to push the pee out.
Absolutely.
So cover, don't hover. And that way the pelvic floor gets to completely relax and you get to fully empty, which can also then help too if you do suffer from chronic bladder infections.
Yes. Yeah.
So cover, don't hover. That's my tip to add to all of Natalie's amazing information.
I love it. I also will kind of piggyback on that too. No power peeing. A lot of times people will say, I'm going to go pee really quick. And my response always is now, oh, no, take your time. Don't go fast. Actually sit down and relax. I say that in public at cafes to people all the time, because if you are pushing your pee out, then that can lead to unnecessary strain again on your pelvic floor and more downward pressure. And when we talk about prolapse, which is that descent or non-optimal movement of those pelvic organs, we don't want to add any excess pressure downward if we can avoid it.
Exactly.
So yeah, sit down, relax, take a deep breath, put your elbows on your knees, and
take your time
pee.
and pee and cover if you need to.
Covered, yes.
Yes. Okay, so posture, as you were saying, in terms of helping with good habits for the pelvic floor, watching our breath, making sure that we're not constipated. What other tips do you want to add to that for good habits?
Yeah, let go of your belly. Let go of the tension in your core. Oftentimes, I'll speak to women specifically because this is like, I call it Natalie science. I don't know if it's backed by actual studies, but
your experience, it says a lot.
Yeah. So oftentimes we end up breathing, like you were saying, Lori, in our chest. We inhale and our chest rises up and our belly goes in. I think that's mainly due to girls feeling like they have to hold their bellies tight for their entire life. Like we're told, suck it in, suck it in, suck it in, hold it tight. And for photos, the culture, whatever it may be, and we end up with a non-optimal breathing pattern, which then affects how our core functions. So let your belly go. And everybody can do this while you're listening. Let your belly go and then let it go again because you're probably still holding tension. And that allows you to have a full range of motion of those muscles. So your core will actually get stronger. And if you're worried about aesthetics, it will look better eventually. If you think about holding a muscle tight at all times throughout the day, if you were to hold your bicep tight all day long, how hard is it to pull it straight again? It's going to be all cramped up. And how effective is that muscle? It's not. It's not going to be strong and resilient and able to lift or do things in case of an emergency, catch a ball thrown at your head by your kid, things like that. Same with your core. If you're consistently holding tension there, and I'll add to your glutes, relax your glutes. Oftentimes we're butt grippers without thinking about it. Then your core is not going to be as effective or as strong or as resilient to catch you when you go to reach for something or catch that ball. And we may end up leaking because of that excessive tension. There's no room for that beautiful ebb and flow of the breath if we're always holding tight. So yeah, let go of your belly. That's another one. I think my last one that I'll say is check out your footwear. Look at your feet. There has been an actual study done. This is one of my favorite studies, that the increase in height in heel height of a shoe leads to higher instances of urinary incontinence. If we are constantly standing on ramps, lifting our heels up all the time, then we're not going to have the ankle range of motion. We're not going to have our feet work how they were designed. Our feet need to spread out when they interact with the ground and be able to propel us forward. And modern shoes, conventional shoes, do not allow our feet to work how they need to. And so consider transitioning to minimal footwear or barefoot shoes. Spend more time barefoot as much as you can. The saying, barefoot and pregnant, do that. It's going to be the best thing that you do for your health, your pelvic floor, your overall posture, your ankle pain, your knee pain, your hip pain, your back pain, your neck pain, all of the above. Your feet are really the foundation of everything. And so if they are strong, then the rest of your body is going to follow suit. So I oftentimes say the stiffer the shoe, the weaker the foot. So the more support you have on your feet, the less they will actually work for you. So I've got lots of resources as well. We can link in the show notes.
We'll link those in the show notes. Well, and the other piece, especially for our runners, postpartum and experience that leaking, the whole foot is about also absorbing ground reaction forces.
Absolutely.
So to your point, Natalie, if you're in this rigid shoe and you have a foot that's not functioning appropriately, it's just going to continue to lead to more leaking down the road.
Yeah. Yes. It's all connected. It's amazing.
All connected. Yes, it is. So this question that I have for you, Nat, may kind of be a little similar to the one that we just said, but I just want to make sure that I'm not missing anything here. So what can someone do prenatally to also help with their pelvic floor?
See a pelvic PT.
And why would you say that? Yes. And why, if you can elaborate on that then.
I would say the amount of modern conveniences that we have in our world, we're not deep squatting all day to, pull vegetables out of the ground. We are not moving as much as we should be, as much as we're designed to. We're sitting in a chair for work. We're sitting on the drive to and from work. We're sitting to watch TV after work. All of that chronic sitting, it's an epidemic, and our hamstrings get tight, our pelvic floor gets tight, our low back is not as strong. So there's so many reasons to start moving more and moving more mindfully. But also a pelvic PT can do an internal exam, and they can actually assess all of the muscles of your pelvic floor. Here's Penelope.
Hello,
She's got the
Penelope.
muscles. So there's like 14, 15 different muscles down there. And pelvic floor PTs, if you consent to it and if you want that, you can do an internal exam and figure out what is working, what is not, what is too tight, especially if you're hoping for a vaginal birth in the future. You're just setting yourself up for success if you assess that now and then work towards keeping that balance throughout pregnancy and during your labor. Because if we don't know what's going on with our bodies, and oftentimes we're very disconnected with that part of our bodies, it's where we hold a lot of trauma and emotions as well, and we tend to disconnect, then we're not going to be as aware or in tune with what's happening throughout pregnancy, and then maybe run into some issues postpartum. So I'm not necessarily saying you can prevent everything, but you can really put a dent in in some of those issues, and you can hopefully prevent most of them if you're well aware of what your pelvic floor is doing, prior to birth.
Yes.
So, yeah.
Yes. So what would you then say, Nat, how does the pelvic floor change with pregnancy?
It absorbs a lot more forces from inside. You have a growing baby, growing uterus, you've got excess weight on top of your pelvic floor. And the natural tendency is to want to shift those hips forward and kind of jut your hips out, pushing your belly
walk,
out.
Right?
Yeah,
that
exactly.
Pregnant walk. Yes.
Yes. So if you find yourself doing that, then see if you can adjust and bring your hips back. You might notice that you look less pregnant because your belly and your baby are sitting more inside of you rather than in front of you, which by doing that, you can also reduce the severity of diastasis, that separation that happens down the center of your abs. You can breathe better. You can get a deeper breath. Most of the time, if I have somebody who's very pregnant and they've been standing in that, classic pregnancy posture with the hips way forward, the upper back way behind, and they complain of shortness of breath. Once we get them back into that more stacked and aligned posture, they're like, oh my gosh, I can breathe again. I have room in my diaphragm. I can get that deep breath that I've been wanting. And so that's, I would say, like, I guess I'm going back to the what they can do, but the pelvic floor also is affected by relaxin and increased amounts of progesterone during pregnancy, which makes things a little more loosey-goosey, which is the technical term.
Yes.
So you have a lot more laxity in your joints during pregnancy, and that also affects your connective tissues as well, as far as like the linea alba, which is the center connective tissue, your pelvic floor muscles. And so the tendency may be to tighten your pelvic floor or clench because your pelvis itself feels more loose. But thinking about, okay, I don't want to tighten my pelvic floor. I don't want to get it excess tension because it needs to relax to have a baby. Our uterus pushes our baby out. Our pelvic floor does not. It needs to get out of the way. And so all of the people prepping for labor with like a million Kegels, they're kind of working against themselves, right?
Yes,
so
yes.
the pelvic floor, it absorbs more pressure and tension during pregnancy. It may get tighter, but to combat that, you want to strengthen your glutes, your hamstrings, all of your surrounding hip muscles so that it doesn't feel like it has to take on that excess laxity and pressure alone. We also have more weight in the boobs. Our boobs grow getting ready for breastfeeding if you choose to go that route. So that forward rounded posture of the shoulders oftentimes happens as well. And I know I keep getting off topic, but going up from the pelvic floor, if we are avoiding that rounded shoulder posture, we're usually pulling our whole shoulders back and pushing our rib cage up, which also affects the pelvic floor because then your diaphragm and that pelvic floor cannot have that same communication that we talked about at the beginning, that beautiful ebb and flow of moving up and down with each other. So it increases the tension, decreases the function, and oftentimes it leads to dysfunction of leaking, maybe potential prolapse or pain. There's a lot of pain that is associated with pregnancy that's considered normal, but that can oftentimes be avoided by strength. So Yeah. Does that answer the question
It
in a
totally
roundabout
does.
way?
Yes, it does. Well, and you're saying like off topic, but it really is still all topic because the body is all connected. And so to kind of piggyback off of your rounded posture, when we're in that rounded posture, our whole thoracic spine is not in a functional position to give us full turning and twisting and rotation. And so that then leads to abnormal pelvis positions, which then leads to the pressure that we were talking about. So it's all connected. And so, as Natalie was saying, to go and see a pelvic floor PT, when you're working also with the pelvic floor PT, it isn't just about them assessing just the pelvis and the pelvic musculature. They should be looking at posture because you could be stuck in your mid back, right between those shoulder blades, that could be affecting down below and vice versa. So the whole chain is connected. Sleep becomes really, really challenging, especially as we grow the baby. So is there any fun tips that you have about supporting the pregnant mom through sleeping postures?
Sleeping postures are difficult because everybody is so different. Lots of pillows if you can, prop yourself up. Ideally, you still shouldn't be getting up throughout the night multiple times to pee. That might be a little bit of a yellow flag to address with your pelvic PT and figure out, maybe I have some urgency. Maybe I have some incontinence that I'm not addressing. It gets harder and harder as you get further along in your pregnancy because that bladder has very little room. But making sure that you are well hydrated and keeping up on electrolytes. If you are not hydrated, if you're shortening or reducing your water intake before sleep on purpose, so you don't have to get up in the middle of the night, your concentration of your urine goes up. It gets less watered down. And so that is actually a bladder irritant and can cause you to leak or cause you to feel like, oh my gosh, I have to pee right now. So it's a fine balance, of course. I'm also a huge advocate for magnesium. Most people in the US at least are magnesium deficient. So if you're not sleeping well, if you're uncomfortable, then that's something you can talk to your provider about as well, is increasing your magnesium intake. But yeah, find whatever position is most comfortable for you. Sometimes people like to do that core breath where they really inhale, expand, and exhale, just lift their pelvic floor slightly right before they go to sleep. It's a calming breath. It can help relax your whole nervous system. So that's a good time to prep and practice that breathing as well.
Yes. Well, and I like that you were saying too, in the sense of irritants for the bladder. And this is not even have to do with pregnancy alone, but caffeine, carbonated drinks, as well as alcohol are irritants to the bladder. So if you're finding yourself leaking or just peeing more frequently, check and see how much you're consuming throughout your day, because it will be an irritant. So
there's another thing I'll add to that, actually. If you count your 1,000, 2, 1,000 slow seconds when you are peeing, ideally a full bladder is about 10 to 12 seconds long. So if you feel like, oh my gosh, I have to pee, and you put off the urge and you're like, okay, I'm actually going to go to the bathroom, start counting every single time you pee to see if your bladder is truly full. And that can be a really good indicator to help you figure out, oh, like, okay, maybe I've gone too soon in the past and trained my bladder to think that it's full when it's only halfway full, something like that. So
love that.
That's
love
a fun
that.
tip.
Well, and because a lot of times too, people won't drink water because they then don't want to go pee, and you're just adding then to dehydration. Again, pregnancy or not, birth or not, and that just leads to other problems down the road. Yes. I mean, we need hydration.
Yes. There's another fun tip that I love talking about. It's like a biohack. It's like a body hack. If you have the urge to pee and you're like in the middle of the grocery store, you feel you can't hold it, you feel like you're going to wet your pants, then do some slow, mindful calf raises. Squeeze those calves really nice and tight. Lift up. You can add in that exhale and pelvic floor lift as you come up. Inhale to lower. Do about 5 or 10 of them. If you're in a place where that is not acceptable, you can do it also sitting. You can also just scrunch your toes, make a toe fist with your toes. There's a nerve that goes through your calf, and when compressed, shuts off that signal or helps to shut off that signal from your bladder to your brain. And so it can bide you a little bit of extra time to get to the bathroom without leaking.
And without rushing. Okay, I do have to go. You can still use this technique that Natalie's talking about, walk calmly to the bathroom and then relieve yourself and not always be in this state of panic and anxiety.
Right. And the other thing too with that is oftentimes it's the key in the door syndrome where you're coming home from work, you didn't pee before you left, and you're like, oh my gosh, I have to pee. As soon as you put the key in the door, you leak. And so that's a trigger, and it's a very real thing with urgency. And so I oftentimes have clients, if they're dealing with this, they go home a different route. They hum a song while they're opening the door. They walk backwards into the bathroom because the sight of a toilet just makes them leak. And so whatever you need to do to be really creative at distracting your brain is excellent. Come up with whatever works best for you, but know that these things are treatable. It's rehabbable.
Yes, it is. Yes, it is. So, okay, so now you've kind of taken us through preconception, the changes that happen in the pelvic floor during pregnancy. Now it comes time for birth and the laboring. So if you can elaborate a bit on that process of what happens with the pelvic floor.
Labor is like a Spartan race. You never really know what obstacle you're going to come in contact with. From even before the labor, I'm going to back it up just a little bit, from about 36 weeks on, I encourage clients to change their core breath strategy and do what we call a reverse Kegel. So instead of inhaling and expanding, exhaling and engaging the pelvic floor, we simply inhale and expand, and then as you exhale, you keep that expansion in your pelvic floor. So you're training to relax regardless of the exhale or the inhale. Like I said before, your uterus pushes out your baby. Your pelvic floor does not. So it needs to relax and get out of the way. So the more you can train and encourage your pelvic floor to let go, hopefully the more smoothly and more efficient your pushing phase will be. The more movement during labor, if at all possible, if you can get up, move around, be on all fours, do a lunging position, slow dance, wiggle your hips on a ball, be in the bathtub, the more movement, the better. Motion is lotion when it comes to exercise and when it comes to getting a baby out. If you think about belly dance movements, that was originally designed to help get babies out. Move your hips, practice that before you go into labor so you are familiar with those movements, and then do them during your labor experience. Something else to think about is when you are vocalizing, when you're making sounds, there's a really cool, if you Google vocal cords versus pelvic floor, you'll get a bunch of images that show the similarities between your vocal cords and how your pelvic floor looks. Those muscles are very similar. There is a connection. It's not that odd. It's just the other end of the tube.
That's right.
So the higher pitched sounds that we have, and if we're squealing, if we're yelling, if we're screaming higher pitched, then our vocal cords go tighter. Our pelvic floor goes tighter. So the lower, deeper growls, the primal sounds that you can do, the as low as you can go. Some people say, I was making sounds that I didn't even know my body could make. Vocalizing during labor, keep it low. Some people are quiet, that's fine. But if you are going to make noise, keep it low. That can also help relax your pelvic floor and keep it open and supple and ready to allow a baby to come through. As far as specifically pushing, ideally you don't. Ideally, you let your body do its thing and you respond intuitively. This is more challenging for first-time parents. It's also more challenging if you have an epidural because you can't feel as much. You can't feel where baby is exactly. So when you have that urgency to push, follow it. Sometimes it can relieve some of the pressure and pain. A lot of times, specifically in the hospital setting, women are coached to take a deep breath and hold it, curl around their baby, and push as hard as they can like they're having a bowel movement. It kills me to hear that. That's not the most efficient way to push out a baby. Oftentimes they're also on their backs. Now, there's nothing necessarily inherently wrong with pushing out a baby on your back, but it's going to make it more challenging. Some people are way comfortable on their back. I've had clients who come back to me after taking my class and they're like, okay, I thought I was not going to push on my back, but then it was the most comfortable. You do you, boo. That's like my thing. But if we think about how that sacrum moves, we're coming back to that theme again. If we're flat on a bed or on the floor, that pushes that tailbone up and it creates a smaller opening for the baby to come out. So by any way if you can just roll to your side slightly and give your sacrum room to expand and open up, or hands and knees. You have plenty of room for that sacrum to get out of the way, that tailbone to get out of the way, then that is going to be optimal. The other thing to think about is when you're pushing, you can practice this here with me. So one hand on your lower belly, underneath your belly button, and one hand on your upper belly, right underneath your rib cage. Okay. Take a breath in and then start blowing the air out like you're blowing a pinwheel or blowing bubbles. So you're breathing all that air out. Keep going, keep going, keep going, keep going, keep going, keep going, keep going. What you should feel under that top hand is kind of a compressive feeling, like it's pulling down and away from your hand. From your belly button to your perineum kind of poofs out, right?
Yes.
That is ideal for pushing. So that breath, you're getting that pressure from the air and from the lungs to start that effort downward, but then the bottom of your belly and your pelvic floor are relaxed and they can absorb that force and allow that baby to come through. So that's a really good way to push without holding your breath and running out of air and being on your back and doing the hardest crunch of your life, right?
Yes.
I think it's so funny. We're telling pregnant women, don't lay on your back and don't do crunches. And then what do a lot of providers have them do when they're giving birth? Lay on their back, do the hardest crunch ever, and hold their breath. That just doesn't make sense to me at all. So if you can be in a more natural position, more upright, you're working with gravity, you're allowing your sacrum freedom, and you're pushing intuitively. You could also think about the example I love to give is a toddler pooping behind the couch. They're most often in a squat position. They're in privacy. So that's also something to consider when giving birth, having the room dark, having only people who you are comfortable with seeing you poop be there. That's a really good standard to draw the line. So your mother-in-law or whoever's uncle doesn't join you in the birth room. And then allowing yourself to use force, but be intentional with how you direct it down. So that toddler, if you have that image in your head, usually they take a little breath and they hold it for a time, but then they let it go and they grunt. So it sounds like this, right?
Yep.
And so that's kind of a good way to think about directing that pressure, using that force from that air, and then letting it go, but sending that energy downward rather than sending it all out upward, like through your mouth. Okay. So that's something to think about as well when you're pushing. Most second, third, fourth time moms say, took fewer pushes. I hardly had to push. Your body knows what it's doing. If you were in a coma and you were in labor, it would push out a baby just fine on its own. So that's something else to remember and keep track of. Like, my body knows what to do. I just need to work with it. And the other thing I'll say about
such a foreign concept to everybody, right? Yeah.
Right?
We always think more is better. Go with the flow. Hard when you're in pain. Yeah, but a reminder of letting it go. Well, and I like to always give the visual too, even if I'm doing post-rehab work. Picture like a flower blossoming and opening.
I love that.
Even jellyfishes. I don't know if you ever like watch them in the water. There's like that, yes, there's that contraction, but then there's also the opening.
Yeah. The last thing I'll say is centimeters matter when it comes to a head coming out of your vagina, right? So if you can give yourself the most freedom of movement and space in your pelvis, the thing I will tell you to research and look up is closed knee pushing. So remember, the sacrum tucks under if you are lying flat on your back. Oftentimes what we imagine for birth is the knees spread wide, that spread eagle position. What that actually does is close the pelvic outlet even smaller. It brings the sit bones closer together and allows less room and more tightness of that pelvic floor. So it's opposite of what we think. Hollywood has made us believe that that's the best opening position. Even providers will say that. Get your knees as wide and close to your ears as possible because it's going to open your pelvis. It actually is opening the top. It's opening where the baby comes in to begin with, but it's closing down that outlet. So if you can get off your back, ideally hands and knees, upright, squat, or a half kneel position, and then actually bring your knees closer than your ankles, it will open up those bony parts of your pelvis and allow more freedom of movement and help to expand your pelvic floor. So if I was to tell anybody one thing to prep for labor, get your pelvic floor familiar with letting go and look up closed knee pushing positions and advocate for yourself to do those during labor.
Love that. Is there anything, Nat, that they can also be doing to the perineum prior to birth and labor?
Yeah, so it's a controversial topic, perineal massage.
And if you can maybe explain, sorry to interrupt you, but maybe if you can even explain what the perineum is, and then we could explain what we're talking about.
I've got Violet the vulva here. Perfect.
I love it. We're using all the props today.
Yes. So the perineum is a space between your vagina and your anus. So that tissue at the bottom of your vaginal opening, the bottom of your vulva, that stretches and opens and oftentimes can tear during delivery. So there has been a lot of talk about massaging that perineum prior to birth, getting it prepared. There's a lot of different approaches that you can take to this. It's not like a massage where you're getting knots out. It's not necessarily you're going to treat it now and then it'll be loose and floppy and amazing during labor. It is a more so mind-body connection that if you are okay with it and if you are feeling good with it, you can apply some pressure. And of course, with lube, some oil, you can do U-shaped pressure massage at the bottom of your perineum. You can do it to yourself or have your partner do it for you. But the idea is that you apply slight pressure and you breathe through it and you allow your pelvic floor to relax and let go. And then you find the next position of pressure. And so you have that muscle memory of what it's like to have pressure in your perineum and release and surrender to that pressure. I've had clients have very good success with this and feel like, yeah, that was like really helpful and I didn't tear and all of that. I've also had clients say maybe they have history of sexual abuse. Maybe they have a very big disconnect with their body. Maybe they just feel uncomfortable with that. Then it actually causes them to tighten up. And so it's not as effective. It's not going to be helpful to allow your pelvic floor to release. They found other releases more beneficial, like the posterior pelvic floor one where you sit on a tennis ball underneath your sit bone, things like that. So there's also a product called the Epino, which is not really sold in the US. But the idea is that in other countries, they used progressively larger gourds and they would insert the gourd to the vagina and relax around it and then increase, kind of like a dilator situation. So you can use pelvic floor wands, you can use dilators, all hopefully with the supervision of your pelvic floor PT and guidance to see if you even need that. Be encouraged that the cocktail of labor hormones that you get naturally from your body will make that tissue, like my midwife friend says, chewed bubble gum. Like it's so elastic and open. And so you don't have to necessarily worry if you are touching your perineum now and you're like, how on earth is a baby going to come out of that? Be encouraged that that tissue is not the same as what it is in labor. You will get more hormones, more laxity to it. So yes, there's oftentimes benefit to perineal massage. It can be great if that works for you, but a lot of times clients choose to not do it because they're, uncomfortable with it or it feels foreign to them. And they still have success and avoid tearing as well. And the other thing to note on this is tearing isn't necessarily the worst thing in the world. Sometimes the body needs to open a little bit and release that pressure to be able to birth your baby vaginally. And that's not a bad thing. A lot of times I hear tearing is the number one fear of first-time pregnant moms, but it is usually better than an episiotomy where they cut manually. A natural tear doesn't necessarily always have to be stitched up. It heals much better, that those natural torn edges come together easier than a straight, scissor cut. So something else to remember and keep in mind.
Yeah. Well, and I think it's a great reminder of just remembering really what you are in control of is trying to keep yourself as relaxed as possible. Yes. And so, okay, we've walked now through the birth and the labor, and now we are postpartum, Nat. And so
yay,
we made it. And so how would you suggest building back the pelvic floor postpartum wise?
Yeah. Rest first. Sleep when you need to. That is going to be the most valuable thing in your recovery. I'm not like a lot of other exercise specialists who are go harder, go faster, go stronger. it's not the time for that. And rest is going to do you really well. The other thing that is related, sort of off topic, but related, is nourish your body with good warm foods postpartum. It's really crucial that you give your body things that are easy to digest. No cold foods. If you look to all other cultures in the world, they have a period of like 30-ish to 40 days after birth of eating warm foods where the mother is resting and really taking care of herself, or someone else is taking care of her so she can take care of her baby. Well, I recognize that's not possible for everyone in every situation. The more nourishment you can give your body, the better. Your tissues rebuild with nutrients from food.
Yes,
And
they
oftentimes
do.
we forget that. We think about the physical recovery as separate from eating. Now, I'm a huge proponent of eating animal foods, and I know that's not everybody's jam, but the more you do research on it, there's really no replacement. And slow cooked meats are awesome. Bone broths, rebuilding minerals, all of those things are hugely important. I would recommend everybody read Lily Nichols' book. But if we take out the animal foods and the cholesterol we need to make those sex hormones, then our recovery is oftentimes less great. And so some people who are vegetarians or vegans, they will actually opt to eat meat during pregnancy and postpartum because it's been shown by the research to be the most crucial time of building. Like you're literally building a human, right? And an organ,
Yeah.
the placenta. And so it's really important to do that. So if you want faster, more efficient, better tissue healing, eat lots of things with collagen, meat products, good quality dairy products, all of that. And I know that sounds weird coming from an exercise person, but if you don't have the foundation and the building blocks to improve your tissue quality, then it's going to be harder to do it through exercise. So you're just aiding yourself as much as you can, setting yourself up for success if you're nourishing your body well. As far as exercise, you can start the core breath 24 hours postpartum. Ideally, you're horizontal as much as you can be in the first week, if not a couple weeks. You then can add in maybe a glute bridge where you lift your glutes up or your hips up off the bed or the couch or the floor, coordinating that with the breathing. Then you roll to your side. Think about kind of how a baby moves. They start on their back, then they roll to their side. It's developmentally appropriate as well. You start to do maybe a leg lift while you're breastfeeding on your side. If you can coordinate that, building up your hips and the coordination of your core with your hip muscles, because those are going to be tired and sore. Then you start to go a little bit more upright. Maybe you do some hands and knees stuff. You roll to your belly, you press up, you do some core activation in hands and knees, maybe like a bird dog kind of movement. Then you go up to sitting and you see if you can lift one leg at a time without totally losing stability. Maybe you do some arm movements. Your shoulders are going to be tight. You activate, you do some rows, or you do some band pull aparts to just get the back of your shoulders to wake up and the front of your shoulders, your pecs to release. Then you start to add in maybe a squat really mindfully. You can do it while you're holding your baby. Then you add in a leg lift in standing. And then you start to do a lunge. And then you start to increase the speed and the load and the different types of movement that you do. But that will carry you for pretty much the first 8 weeks. You're slowly moving from your back all the way up to standing in a split stance in a lunge. So it's not a specific reps and sets, but I don't think it needs to be. You need to listen to your own body, but that's the way to progress. If you are a runner or a jumper, you want to go back into high impact activity, the current research is showing don't go back until you, number one, are building up to it, but at least 3 months postpartum, if not 6 months. It takes about a year to recover from childbirth, if not longer. It took at least 10 months to make the baby. If you've heard this saying, the first 40 days sets you up for the next 40 years. And oftentimes postpartum hormones, breastfeeding hormones can give you a glimpse of perimenopause, postmenopause, which is very interesting. You have the vaginal dryness. Sometimes with breastfeeding, you have the night sweats. You have a lot of similar symptoms. So it's a glimpse in the future. So if you can nourish your body really, really well during that postpartum time, hopefully your perimenopause, menopause time will be that much smoother. It's kind of an interesting perspective, long-term perspective.
Yes, it is. What about bathroom habits postpartum?
use the squatty potty. Breathe your baby out, breathe your poop out.
Breathe your poop out. Yes. Very true. And now, is there anything that you want to add about prolapses?
Yeah. I have a lot to say about prolapse. I won't go on a too long of a tangent, but there was some research that showed that about 80% of women in the first few weeks postpartum had some degree of prolapse following a vaginal birth. It just makes sense. Prolapse is the descent or movement downward of those pelvic organs. And if we have pushed a baby out downward and there's laxity in our connective tissues, then it just goes to make sense that we would have some slippage, for lack of a better word, of those organs. So that's just another reason. Like 80%, that's a really high stat, right? If you can stay horizontal, do the gentle bridges, encourage your body to heal. If you are doing too much in that first week, then it can prolong that prolapse for longer and increase your recovery time. So do yourself a favor of really being mindful, really breathing well. You can wrap your pelvis and your lower abdomen with a postpartum wrap. The Belly Zinc one is the one that I recommend. Because
it's a great
adjustable. Yeah, it's adjustable and it's not a waist trainer. It doesn't squeeze from the middle of the toothpaste tube. It supports gently from the bottom.
So you can then get a normal breath is what you're saying, right?
Exactly.
It doesn't impede breathing.
Yeah, it just assists in that muscle function and helps you feel, okay, I'm taken care of. It's like a gentle hug, right?
Yes.
So prolapse, it's also not a death sentence. It's a very scary thing, but more education, more awareness about it leads us to understand and be able to advocate for ourselves and see a pelvic floor PT as soon as you are able. Generally, they won't go internal until past that 6-week mark, right? You're on pelvic rest until 6 weeks postpartum most of the time, if not 8. But get booked with a pelvic PT during pregnancy for about 8 weeks past your due date. That's what I would recommend. If you're on the books, right? Most good pelvic PTs are pretty busy. So if you can get on the books, you can at least move that appointment around. And then it's one less mental load piece that you don't have to think about after you have a baby.
Right.
But yeah, being mindful of not straining on the toilet, being mindful of not holding your breath and bracing when you're lifting things in those first few weeks is key. So
and there's also pessaries, right? There are pessaries that you can be fit with if it is something that's annoying you, that it's kind of fits like a diaphragm and can support those organs while you're getting your rehab taken care of.
Yeah, they can be an excellent tool to help get those muscles back into the place they need to so they can function well. I know here in Alaska, a lot of moms I need to be able to hike up this mountain with my child on my back. And if they have prolapse symptoms while they're hiking, but not at any other time, it decreases that quality of life. And so they may choose to get a pessary just for the hikes and use it occasionally. And that relieves their symptoms, helps them get stronger, and helps them feel better mentally because they're doing the thing that they love, but avoiding feeling all the icky things that the symptoms like lower back pain or pressure downward on your perineum, all of that.
All of those. And what about carrying the baby?
Oh, yeah.
Because that feeds into our posture, right? Wrong posture, wrong pressure leads to more could prolapse as well as leaking and those types of things. So any tidbits about baby carriers, how to carry your baby, what to be mindful of during that time?
Yeah. Get a carrier that fits you well to begin with, that supports you well. I don't really recommend baby wearing for the first 10 days because you shouldn't be up and about and trying to get more things done with both hands during those first 10 days anyways. And ideally, the more time you can spend horizontal, the better, which we talked about. But finding that same stacked, untucked booty posture with the carrier will challenge your core more. So yay, bonus core workout, but also take the pressure off of your low back. If you have a lot of pressure, if you have a lot of pain in your shoulders, your carrier probably isn't the appropriate carrier for you or your child. Cassidy over at Let's Talk Baby Wearing is one of my top resources for sending people because she reviews pretty much every type of carrier and talks about how to use it, how to adjust it. I love her resources and she's very, very helpful. So find somebody who can help you fit one. A lot of times you can also try friends on prior to buying your own. So it can save you some headache of searching for the right one. But yeah, in those first few weeks, see if your partner can carry the baby for you, wear the baby, but make sure that your posture is great. Yeah.
And I just want to circle back to make sure that everybody is understanding this too. So as you're saying, we can get into just some nice, easy core breath after baby. Can you just review for us one more time what core breath is and how it looks?
Yeah, absolutely. So it's an inhale through your nose, nice and gentle, expanding your rib cage, your belly, and your pelvic floor. So everything expands and opens as you breathe in. And then as you exhale, you can add in a rounded lip exhale, like you're blowing bubbles through a wand or blowing a kiss, whatever it may be. Slowly breathe out. You can add in a little pelvic floor lift, like pick up a blueberry with your vagina. Think about maybe a Kegel, but you're lifting up towards the crown of your head rather than just squeezing locally.
Right.
As you're breathing out, naturally, your deep core will activate and wrap around you and make you feel stable and secure. And that is a foundation and basis for pretty much every exercise. And it will help retrain your brain and your body connection to know that when you get up out of a chair, when you catch a ball, when you throw a ball, when you pick something up off the floor, your core is already there to support you. It should have an anticipatory action. So it should turn on prior to whatever task it is that you're going to do. Oftentimes we run into, oh, my back hurts when I put on my sock. It's because the timing is off. So if you can retrain with that breath, slowly introduce movements, slowly introduce more load or weight and speed and reps, then you'll get stronger and retrain that whole system.
Right.
So.
And, and that's the thing to remember, ladies, is that you don't need to go back necessarily into the gym. Your whole house and new lifestyle with the baby is your gym. The baby's going to gain weight. You're going to be lifting heavier. Always get into that practice. I tell people, you're lifting up the laundry, inhale down, exhale up. You're lifting that baby out of the crib, same thing. Get that breath before and exhale, and so that it becomes this reflexive, natural breathing pattern.
Yeah.
And now, are there any other resources that you can recommend that will give people maybe some ideas of some natural movement that they can do throughout their day?
For natural movement, I love Katie Bowman. She has written numerous books. She has a podcast, and she's not really on social media because she practices what she preaches, but she has a lot of information on her site. I also like MoveNat, MoveNat, for ideas of more natural movement, like crawling and jumping and hanging and things like that. I have my own course, which is called Mindful Movement in Mere Minutes. It's on my site. You can find it at trainernatalie.com or moveinminutes.com. And I go through a lot of what we talked about, the breathing, the posture, specific muscle releases, how to squat, how to lift, how to do all of the typical lifts that you would experience in the normal workout with good form, with mindfulness, with the breathing. And then there's some workouts in there as well. So yeah, that's a good place to start.
Wonderful. Well, and I encourage your class, again, even if you are not down the path of baby, because this is just movement that we need also as humans.
Your body is worth it. Your body is worth that investment.
That's right. Well, Nat, this was amazing, so informative. Any last bits you want to add in before we close?
I think something that has been a theme with my clients lately is building back trust with our bodies. And you have to trust your body, and your body has to trust you to heal. But you are the only expert on your body. So you can take every course you want. You can read all the books that you want. You can do whatever exercise program, but you're really going to truly heal when you build that trust with your body, which looks like showing up for yourself in whatever way that makes sense to you. Gentle, nourish your body well, let your body trust you again and start to trust your body again. And that is the way to healing and feeling better.
I love it. I love it. Well, again, Nat, thank you so much. For those of you out there, everything that we talked about today will be linked into the show notes. Also remember that Natalie has her own podcast called The Resource Doula. So again, a slew of information. I know you also bring on some other birth professionals. So please go ahead and check out her podcast as well. And I am sure we will be circling back and doing this more in the future together, Nat. I love your work and I love you. So thank you.
Aw, thank you, Lori. Thanks so much for having me. It was a pleasure.
Yay. Well, we will see you all soon.
Bye.
The information shared on this podcast is for informational purposes only and is based on the opinions and experience of Lori, Dorothy, and their guests. The content should not be used as a substitute for professional medical advice, diagnosis, or a treatment. Always seek the advice of your healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.